Hey, what's up and welcome to the last bonus lesson in Power Up Endo's 90-day Super GP training program. I'm so excited that you've worked all the way through the entire training program, and let's get right into this last value-packed bonus. So in bonus 5, this is completely dedicated to choosing a file system that works for you. So you is the imperative word here because there are a ton of products in the market, and there are major players that most people go with, and there's advantages and disadvantages. A lot of these file systems I'm going to recommend to you based off what kind of endo cases you're going to be seeing in your general practice. So if you're handling just the occasional central or lateral maxillary incisor, that's a different recommendation than if you're going to be handling a very broad set of cases. If you're going to handle, your anteriors, your premolars, your molars, your upper, lower, doesn't matter, you're going to do it all, that's going to be a different recommendation than the GP who's going to only be doing, maxillary central incisors. And so I want to take this opportunity to let you know that each file system has its advantage and disadvantage, and I'm going to go over that with you. So I've shown you this image earlier in the training program, but I want to go over it with you again because it really stresses the point home on how important your chemical disinfection is. So if you look at these micro CT images, I hope you can appreciate that everything in red has been mechanically debrided with rotary instruments, whereas everything in green are areas where your rotary instruments have not touched. And so I hope you can appreciate that there's a lot of green here. There's a lot of areas inside the root canal system that your rotary instruments don't even come close to debriding. And that's where your chemical disinfection comes into play, mostly through your sodium hypochlorite. All right, that's the secret sauce of endodontics, that your disinfecting solutions do most of the work, and you're just creating the space to deposit a lot of sodium hypochlorite. You got to take your time, especially when you factor that some of these rotary systems are so time efficient that you're done with your instrumentation in like 20 seconds. So whereas root canal treatment used to be, a 3-hour procedure with your tedious step backs, with your hand files, imagine all that time sodium hypochlorite has been allowed to soak inside of the tooth leading up to your eventual obturation. But if you're instrumenting the case in 20 seconds and you're only spending, another 20 seconds on your disinfection, how do you compare the amount of time that the sodium hypochlorite has had a chance to soak in that tooth versus the old-fashioned 3-hour multiple visit root canal treatments where, yes, you're less time efficient with your instrumentation, but that sodium hypochlorite in the meantime for hours has had a chance to soak. So if you're going to do a speedy instrumentation, you got to really take your time and do your due diligence with your disinfection. All right, so keep that in mind. So what I'm going to be doing is going over 4 major file systems with you so that you can understand the features of those file systems, so you can understand what they are really intended for. And then I'm going to give you the advantages, the disadvantages of each file system, and I'm going to give you my personal opinion on who that file system is really meant for and what I think of how great it is to incorporate into your general practice as the workhorse of your endodontic procedures. All right, so let's get into it. So before we get into all the various types of rotary instruments that I want to discuss with you, I want to briefly take this opportunity to talk about hand instruments. I know I talked about this in World 3, but I want to go over it with you one more time because it's really relevant here as well. So first and foremost, in my opinion, Lexicon is the gold standard in hand files. They're put out by Dentsply Sirona, and they are very high quality, dependable hand files that I would encourage you to consider. So they come in pre-sterilized blister packs, which is nice because you can just unpackage the file and you don't have to worry about sterilizing them. They also have color-coded rubber stoppers that indicate whether they're sizes 21 millimeters in length, 25 millimeters in length, or 31 millimeters in length. They have these great calibration rings that help you visualize more clearly how deep you are into a case. This is a size 21 file, but they're typically 18, 19, and 20 in that cluster of 3 lines, one of which is being blocked by the rubber stopper right now. And these Lexicon files, they make K files, they make reamers, which are not used that frequently anymore, they make C files, and they make Hedstrom files. So you're primarily going to be using K files for the majority of your work and C files for calcified cases, and I recommended, like I mentioned, C files for your sizes 10 and below, and then K files for 15 and above. And the reason the C files for those smaller files is because that's going to be your initial entry into the root canals, and that's what's going to help you get to the apex without too much trouble. Headstroms are primarily used for retreatment cases, especially when there's a carrier-based obturation system that's inside the root canal space, but that's kind of beyond the scope of this course. So it talks about how great the pre-sterilization packs are, and I agree. I think they're fantastic, and they come in a 2% taper, which is very normal for hand files. And they're great. You can see all the different types that they have here. You may want to consider getting a couple of barbed broaches. All those are really used for is taking out sponges and cotton pellets. They're almost magic. When you actually need one, you just stick it into the cotton pellet or the sponge and twirl it a few times and pull it out, and it pulls it right out, as opposed to, futzing around with it with an Endo Explorer forever. But, this is the brochure on the Lexicon hand files, and I think they're a fantastic choice for your hand files. I'm going to go over one more choice with you here in just a second. All right, so I'm going to talk to you a little bit more about Edge Endo specifically in the rotary section of this lesson, but Edge Endo also makes hand files, and they are significantly less expensive than your Lexicon hand files. So you may want to consider actually using Edge Endo products if you're a more cost-conscious dentist. And I will, like I said, I'll go over that with you a little bit more. But they sell K files, they sell C files that you can see there as well, and they sell them in all different lengths, just like you get in the Lexicon files, 21 millimeters, 25 millimeters, and 31 millimeters. And they sell all various sizes that you will need as a general dentist performing endo treatments. They are, like I mentioned, a lot more cost effective. You get way more bang for your buck, and they are also very high quality, so something to seriously consider. All right, so let's get into rotary files now. The first rotary system that I want to go over with you is ProTaper Gold, again by Dentsply Sirona. So ProTaper Gold has been out for some time now. Many of us were trained using the ProTaper Universal system, and what they did was they increased the file's flexibility and strength by performing a heat treatment on the file that's a proprietary process, and it actually makes the file appear this gold color and gives it a significantly greater amount of flexibility, and thus allowing the file to not only separate far less frequently, but also handle curvatures much better than their initial Nitai metallurgy did. Now, ProTaper in general are meant to run at a slightly lower RPM, but a higher torque setting. So you're actually going to run these at 300 RPMs, and I'll go over the torque settings in just a second. So you can see here that you can handle some pretty high curvatures using the ProTaper Gold system. This would have been very challenging, if not impossible, with the old ProTaper Universal system, which was much, much stiffer. The rotary files themselves, they come in this sequence. So what you do is you start with your orifice opener, your SX. This is actually the orifice opener that I prefer. So I use the SX, even though I don't use ProTaper Gold as my workhorse rotary system. But you start with your SX orifice opener, and then you get into your shaper files, your S1 file and your S2 file. And these files are really meant to only instrument the coronal for the S1 and the middle third for the S2. They don't really engage in the apical region. That's what your finisher files are meant to do. So your F1 has a 20 tip with a 7% taper. Your F2 has a 25 tip with a 8% taper, and then your F3 is a 30 tip with your 9% taper. You don't typically go higher than an F3 for ProTaper Gold. Not that many canals actually need to be instrumented larger than an F3. And another important feature of the ProTaper Gold system is that they have what's called a progressive taper to them. So that 7% taper, that's a very aggressive amount of taper as you work your way up the file. So what happens is that 7% taper is really only present in the apical 3 millimeters, and then the taper decreases as you go up the file. Because if you had a 7% taper throughout the entire file, as you get to the top of that file, the size would be way, way too big and much too aggressive for the canal orifice level to be instrumented to that degree. You probably perforate with every single canal instrumentation. So it's a progressive taper where the taper decreases as you go up so that the area of the canal orifice isn't some giant hole. That's the ProTaper Gold system. It's a great system. I actually used to use this system. This was partially because I was trained on the ProTaper Universal system. And so I felt it to be a very smooth transition into the world of heat-treated files, which is pretty much the gold standard in NiTi instrumentation, because it has allowed us to have much, much more flexibility and have a much, much safer instrumentation because the files are so much more flexible. And all the files that I'm going to recommend to you, they all now have this heat treatment applied to them, which makes them much more flexible. So that's the ProTaper Gold. I want to go over the tip card with you as well. All right, so here you have the tip card that they put out for the ProTaper Gold files. You can see that they recommend a 300 RPM setting on your endo motor, and these torque values are actually a little bit higher than you would set for most other rotary instruments. But they try to sell you on all these various ProGlider files, which are essentially glide path files. You can accomplish this with manual instrumentation. Your 15 file is what I would recommend, your 15K file. So the sequence that they recommend, like I've already mentioned to you, you start with your purple S1. That's going to shape the coronal 1/3 of the root. It's not really going to engage the remaining portion of the root. Then you're going to irrigate and then go to your S2 file. That's your white, and that's going to prepare more the middle third. You take all these files to length, by the way. It is not a crown down technique. You take them all to length. So you use your S2 file, then you irrigate, and then you start with your finishers, which are going to prepare the apical third, and that's going to be started with your yellow F1, irrigate your red F2, and so on and so forth. So while the tip sizes line up with the ISO colors, and I'll touch more on what an ISO color is in terms of the sequence of colors, purple, white, yellow, red, blue, green, black, so on and so forth, they're not a constant taper. And so the progressive taper is a very, very unique feature to ProTaper Gold, and Dentsply Sirona actually has some other files that also employ this progressive taper technology. Now, in terms of who this system is really dedicated for, in my opinion, if you're going to handle more straightforward cases, like your bigger canals, and not really get into your more tiny little canals that you might find in your molar teeth, then you may want to consider the ProTaper Gold system, because it's a relatively easy system to learn, number one. It's not a complex number of rotary files. It doesn't require that you instrument with, 7 to 10 files. That's another big benefit. But in my opinion, a disadvantage of this system is that the files are actually quite chunky. So one of the reasons that I moved away from the ProTaper Gold system and moved into the Vortex Blue system that I'm going to talk about next is because I find that in small canals, these files are a little bit chunky and they put a lot of force on the NiTi, which can lead to an increased incidence of file separation, which obviously nobody wants. Not to mention that it's nerve-wracking when your file doesn't go all the way to length with very much ease, and then you're having to go back with hand files. It slows you down, and in my opinion, in really, really small canals, which is usually the kind of cases that I receive as an endodontist, these files are just a little big for my taste. So let's move on to the next system. Now I want to talk about my personal go-to, which is the Vortex Blue system that's put out, again, by Dentsply Sirona. So what I like so much about the Vortex Blue system is that it's a universal system. And unlike ProTaper Gold, it actually has a fixed taper or a constant taper. So the taper is uniform throughout the file. And so they come in either an 04 or an 06 taper. And I personally stick to only the 04 taper. I find that the 06 taper is a little bit aggressive. What that means, essentially, in case you don't know, is starting at the very tip of the file, every millimeter, there's a 4% increase in the width of the file. So as you go further up the file, or in this case, down this file, the file gets wider at a rate of essentially 4% per millimeter. So if the higher the taper, obviously the chunkier the file will end up being in the working area of the file and definitely into the coronal area of the file. Anyways, these files, like I mentioned, come in an 04 and an 06 taper. They have significant flexibility. So the initial profile systems is what this was meant to replace. And their proprietary method of heat treating these files, for some reason, turns these files a blue color, which is why they're called Vortex Blue. But they're a universal system, which means that you have much more options as to what kind of cases you can comfortably treat, in my opinion, with these files, because you have two different taper options. Number one, you have sizes all the way from as small as 15 up to 50, which covers almost every case other than that immature central incisor that might come your way, in which case you're going to just instrument with large hand files, sometimes up to 100, 150. And you have lots of options. You can handle any case with this system. They're a very flexible file. They can handle significant curvature, and you can control how narrow or how wide you want to prepare. Also, the smaller files in this system, the 15, the 20, and probably even the 25, they have so much flexibility that you can very easily pre-bend the rotary files to get them into position. So you can do that as well with the ProTaper Gold. It's just that because it's a chunkier file, you can't pre-bend it quite as much. And the advantages of being able to pre-bend a rotary file, you're going to learn this pretty quick, especially if you're doing molar endo, that in some canals, really a lot of times I find the MB canal, the mesial-buccal canal of lower molars, it's challenging to get the correct angle to introduce the file into the canal sometimes. But when you put a little pre-bend on the rotary file, you can much more easily get that file into place in the area of that canal orifice. And so the ability to pre-bend files seems like not a big deal, but for those who do a lot of endo, it's actually a massive upgrade when they started to heat treat these files. So here's the tip card for the Vortex Blue system. You can see the color schemes that they have here to designate their 04 taper files and their 06 taper files. And I'll take this opportunity to talk about the ISO system. So this is an internationally standardized system in endodontics that basically color-coded all sizes so that it's easy, obviously, for you to keep track of which instrument you're going to be reaching for and whatever you have in your handpiece. So white designates a 15 size, yellow a 20, red a 25, blue a 30, green a 35. You may or may not already know this, but it's a great universal system, and it makes it much easier to reach for things when you can very easily see the color, obviously. They use the ISO system to classify all their files. So these come non-sterile, so you'll have to autoclave these before you use them. I recommend you make up packs in sterilization pouches of an entire sequence of files, so you have an entire setup per sterilization pouch. And you'll notice here that they are meant to be run at a higher RPM than ProTaper Gold. So these are run at 500 RPMs as opposed to ProTaper Gold's 300 RPMs. And the torque settings for each of the files are actually a little bit lower as well. Now, in terms of the settings that you put on your motor for the RPMs and the torque values, you want to be very careful to make sure that you're following the manufacturer's instructions. I know we as dentists sometimes are a little bit lazy about following manufacturer instructions, but you want to make sure that you follow the instructions closely, because doing so is going to lessen the chance that you will separate a file, because the values are specific to the metallurgy of the file itself. This file system, in my opinion, is really meant for the dentist who's going to be doing a wide variety of endo cases in their practice, because this system can handle any case that comes your way. Like I mentioned, I actually favor this rotary system, and that's what I use in the case demonstrations inside the Power Up Endo 90-Day Super GP training program. All right, now we're going to get into Wave 1 Gold by Dentsply Sirona. Wave 1 Gold is an improvement on the initial Wave 1 file that they put out, where they basically applied the same heat treatment, or a very similar heat treatment, to the Wave 1 files that they went ahead and did on the ProTaper files. So that's why they became the gold color, and that's why they came out with Wave 1 Gold. So what's unique about Wave 1 and Wave 1 Gold as well is the movement of the files. So these are in a whole different class of files called reciprocating files. So these files don't rotate continuously 360 degrees. What they actually do is they engage the canal for 150 degrees, and then they basically disengage in the opposite direction 30 degrees. And then they go back to the 150 degrees and then the 30 degrees, and they slowly make their 360 degree moves in a combination of engaging and disengaging motions. So what that does is, in theory, it puts less strain on the file and decreases your chance of file separation. Now, that is a supposed plus to this system, and that's probably true. It's a little bit more rigid, though, in terms of the sizing options. So the reason it's called Wave 1 is because it's marketed as being a single file system. So it's a system where you choose initially which size you think the canal is going to require, and then you use that file, and hopefully you chose correctly and you've completed your instrumentation in a single file system. Now, you have to choose carefully, because if you choose poorly, then you will have to use another file, whether it be smaller or larger. Now, the red file here is their primary file, and this file is meant to handle a good portion of canal sizes, but not all of them, which is why they also give you the yellow, which is the small, the green, which is the medium, and then the white, which is the large, as options. But they claim that the red file, the primary file, will handle most of your cases, and they're probably right. But it's an expensive file. A single file is comparable to an entire pack of files, but you're basically going to be saving significantly on time. So that's an important thing to consider. Now, reciprocating files have been accused in the literature of not just accumulating more dentinal debris because the chip space is larger in cross-section, But also the reciprocation motion has been accused of packing dentin and causing a little bit of extrusion of debris out of the apex. Now, that has been accused also of causing an increased incidence of postoperative pain. So you want to be mindful of that you do have the possibility of having some more postoperative pain. But, they market it as being able to handle all types of endo cases, which is great. These are some big names in endodontics, and they try to get you on their obturation systems that match the Wave 1 system. They're a good system, but they're not really intended for the dentist, in my opinion, who's going to handle a massive variety of endo cases. If you're going to handle your centrals and laterals and your canines maybe, and you want the fastest rotary system that you can get your hands on, this might be a good option for you. This is not going to be my workhorse in an endodontic practice, however. Now, another thing that I want you to consider is the speed at which you'll be able to instrument your cases. So if you're going to be instrumenting a case with a single file, that's going to take you 20 seconds to instrument a case. What are the chances that you're going to spend 5 to 10 minutes on your disinfection? Probably not great, because it's going to seem like forever relative to your instrumentation. So if you're going to utilize this system, I highly recommend that you compensate the speedy instrumentation with a long disinfection phase of treatment. So take your time with your sodium hypochlorite and your 17% EDTA, and don't rush through that, because you don't realize it, but all the sodium hypochlorite that you're going to be using throughout your instrumentation technique on most rotary systems adds up, and then therefore your disinfection phase can be slightly shorter. But when you're instrumenting a case in 20 seconds, you got to take your time with disinfection, because you're setting yourself up to leave bacteria behind, to leave pulpal tissue behind, and thus setting yourself up for case failure. And here's the tip card for the Wave 1 Gold system. They have this cool marketing with the surfer gliding and surfing the canal with confidence. They really try to stress that the Wave 1 Gold system is a single file system, and most of your cases you can go ahead and just proceed with your primary file, and the reciprocation motion is going to get you to the apex with a lesser chance of file separation, which is probably true, but you have to be careful to do this very slowly to try to minimize the amount of debris that you're packing apically and hopefully not packing out through the apex of the tooth. But it's a very efficient system, and it's great, like I mentioned, for those dentists who are only going to handle very basic endodontic cases. You'll also want to make sure that you're using a motor that even allows for reciprocation. So not every endodontic motor actually has reciprocation settings. So you want to make sure before you start investing in a system like this that your endo motor actually allows for reciprocating motion as opposed to just continuous rotation. And then finally, I want to get into Edge Endo. So Edge Endo was founded by an endodontist named Chuck Goodis. He actually went to the University of Connecticut's endo program, like I did. What he did is he created an entire line of products, initially just endodontic products, but now he sells all types of dental products. But what they're meant to be is very, very close in geometry and in function to basically every major file system. And he sells the Edge File X1, which is a very close file to the Wave 1 Gold. He sells the Edge File X3, which is a very close system to the ProTaper Gold. He sells the Edge File X7 also, which is extremely close, if not identical, to the Vortex Blue system or other systems like Vortex Blue that have a constant taper and are just your ISO system. And so I'll just open up the X7 file here for you. His heat treatment is called Firewire. They actually are very flexible files, and he doesn't have a 15 file. His smallest file is a 17, but you can see here you can get an entire assortment of files that function very, very similarly to the Vortex Blue files, and they're equally as flexible, arguably even more flexible. They come in the whole assortment of lengths, 21, 25, and instead of 30, they come in a 29 length. And they have them in 04 and 06 taper. Now, the beauty of the Edgendo file systems are that the performance is very close, if not identical, to the major brands, but the price is significantly less. So when Edgendo initially came out, the prices were anywhere between, half to a third of what the major large manufacturers were charging for files. Now they're basically a little bit more than half, at least the prices that I'm getting from the manufacturers. But still, near 50% less in terms of the cost of files for equal, and he would argue even better performance. So something you really want to consider if you're a cost-conscious dentist who wants to control, all your costs and get the procedures to be as profitable as possible, which obviously we all want to do. All right, I hope you found a lot of value in that bonus lesson. Remember, it's not so important in terms of what file system you use. It's really how you use it and what you use between your ears in terms of the knowledge that you have to actually utilize that tool, which is the file system. So I get asked all the time, what's the best file system? And, I have my personal favorites, but it doesn't really matter so much. What really matters is that you're using a system that's safe in your hands and that will open enough of the canal to introduce your disinfecting solutions. Anyways, I hope to see you around, whether it be at a local meeting or a national convention. And if you pass me and you want to say hi, I encourage you to. I really hope to hear from you and to get some more feedback from you, at least in person. Bye now.